Welcome to another episode from the Veterinary Medicine Digest. Today, we delve into a fascinating, yet challenging topic in veterinary medicine: Chiari-like malformation, or CM, in dogs, and its often accompanying condition, Syringomyelia, or SM. While these conditions affect various toy and small breed dogs, our conversation will frequently return to the Cavalier King Charles Spaniel, a breed profoundly impacted by this complex neuroanatomical disorder. For years, the health and welfare of pedigree dog breeds have been a subject of public debate, especially when breed selection practices inadvertently lead to a spectrum of breed-related disorders. The Cavalier King Charles Spaniel, or CKCS, has unfortunately found itself at the center of this discussion, partly due to the emphasis on specific physical characteristics that may be linked to conditions like Chiari-like malformation. Understanding Chiari-like malformation, more than just a chair-like brain. Let's begin by demystifying Chiari-like malformation itself. The term Chiari-like is used in veterinary medicine, a consensus designation established by the Chiari-like malformation and Syringomyelia working group to describe a complex malformation affecting the craniocervical junction of dogs. This condition is often compared to Chiari-type I malformation in humans, a disorder initially described in detail by Hans Chiari. However, it is now understood that canine Chiari-like malformation, or CM, presents with even greater complexity and might be more akin to complex craniosynostosis syndrome seen in people. Think of conditions like Crouzon syndrome, where there's a premature fusion of multiple skull sutures. At its core, Chiari-like malformation is characterized by an overcrowding of the brain and cervical spinal cord. This overcrowding is primarily predisposed by a shortened skull base, a common feature of brachycephalic, or short-nosed, breeds. While many brachycephalic dogs have a shortened skull base due to premature closure of the spheno-occipital synchondrosis, a crucial growth plate in the skull, Chiari-like malformation is considered even more intricate, possibly involving other premature suture closures or insufficient cranial development. In the Cavalier King Charles Spaniel, for instance, a breed specifically selected for a certain head shape, this selection process is thought to have inadvertently led to Chiari-like malformation. Some research even suggests that brain morphology is directly influenced by head phenotype. The prevalence is astonishingly high in this breed. It's estimated to affect around 95% of Cavalier King Charles Spaniels. In fact, Chiari-like malformation is considered practically universal in the Cavalier King Charles Spaniel population. Such high prevalence points to limited genetic diversity within the breed, making efforts to breed away from these problematic conformations quite difficult. The physical changes in affected dogs are quite pronounced. Magnetic resonance imaging, or MRI, often reveals a reduction in the volume of the caudal fossa, which is the space at the back of the skull that houses the cerebellum. This reduced space forces the cerebellum, and sometimes even the brainstem, to displace downwards, either into or through the foramen magnum, which is the opening at the base of the skull where the spinal cord begins. This displacement, known as hindbrain herniation, is a hallmark of the condition. But it doesn't stop there. Other changes can include rostral forebrain flattening, smaller and ventrally oriented olfactory bulbs, and an increased height of the cranium, all contributing to this severe cranial crowding. There may also be signs of raised intracranial pressure, such as a loss of definition in the sulci, the grooves on the brain surface, combined with enlargement of the brain's fluid-filled chambers, called ventricles. Given this complex array of structural changes, it's been proposed that Chiari-like malformation in dogs might be better understood as a brachycephalic obstructive cerebrospinal channel syndrome, or BOCCS, drawing a parallel to the brachycephalic obstructive airway syndrome, or BOAS, seen in these breeds. This new perspective emphasizes the obstruction of cerebrospinal fluid, or CSF, channels, which brings us to the devastating secondary condition, Syringomyelia. Syringomyelia, cavities of discomfort. Syringomyelia, or SM, is perhaps the most debilitating consequence of Chiari-like malformation. It refers to the development of fluid-filled cavities within the spinal cord itself. The term literally translates from Latin as cavity within the spinal cord. These cavities, called syringes, are filled with a fluid similar to cerebrospinal fluid. While Chiari-like malformation is almost universal in Cavalier King Charles Spaniels, Syringomyelia is diagnosed in approximately 50 to 70% of affected dogs and up to 70% of Cavalier King Charles Spaniels in some reports. However, it's important to note that not all dogs with Syringomyelia will show clinical signs. The pathogenesis of Syringomyelia is a fascinating, yet still somewhat unclear, area of research. The core idea is that the craniocervical junction overcrowding and cerebellar herniation seen in Chiari-like malformation disrupt the normal flow dynamics of cerebrospinal fluid. Normally, cerebrospinal fluid flows from the brain's ventricles into the subarachnoid space around the brain and spinal cord, eventually being reabsorbed. When this flow is obstructed, particularly at the foramen magnum, it can lead to the formation of these fluid cavities within the spinal cord. Several theories have been proposed to explain how this happens. One of the earliest, the water hammer theory from the 1950s, suggested that cerebellar herniation blocked cerebrospinal fluid movement during the heart systolic phase, forcing ventricular fluid into the central canal of the spinal cord. While this theory was largely rejected in humans due to infrequent connections between ventricles and the central canal, such connections have been observed in dogs, though their significance is still being investigated. Later, in the 1970s, the suck theory proposed that pressure differentials during periods of increased intra-abdominal or thoracic pressure could force fluid into the cisterna magna, with cerebellar tonsils then obstructing its exit, shunting fluid into the central canal. Around the same time, another theory suggested that obstruction of cerebrospinal fluid return allowed fluid to track into the spinal cord parenchyma via perivascular spaces. However, the documentation of higher pressure within a syrinx compared to the surrounding subarachnoid space argues against both of these ideas. In the 1990s, the piston theory emerged, suggesting that the caudal displacement of the cerebellum during systole created an increased pulse pressure, pushing fluid into the perivascular or interstitial spaces. These pulse waves have even been observed ultrasonically during surgery. But this theory also has limitations, as increased subarachnoid pressure would theoretically collapse a syrinx, not expand it. More recently, the intramedullary pulse pressure theory has gained traction. This theory posits that syringomyelia results from mechanical distension of the spinal cord, and that the fluid within the syringes is actually extracellular fluid, not cerebrospinal fluid. In cases of Chiari-like malformation where the subarachnoid space is obstructed, pressure decreases just caudal to the lesion, but increases within the spinal cord at the obstruction site. This leads to spinal cord distension, extracellular fluid accumulation, and central canal dilation, with the fluid coalescing into distinct cavities. A related vascular theory suggests that increased cerebrospinal fluid pressure could disrupt the blood-spinal cord barrier, leading to leakage of low-protein fluid into the spinal cord. Despite extensive research, the exact mechanism by which syringomyelia develops remains unclear. However, the focus has shifted away from the fluid being of cerebrospinal fluid origin, instead pointing towards an extracellular origin. The intricate interplay between subarachnoid and spinal cord pressures, systolic pulses, and fluid outflow continues to be a subject of ongoing study. Beyond the primary Chiari-like malformation, certain concurrent craniocervical junction abnormalities can also contribute to or exacerbate syringomyelia. These include conditions like atlanto-occipital overlapping, where the atlas bone is too close to the skull, dorsal atlantoaxial bands, and congenital dorsal angulation of the dens. Medullary kinking, an elevation of the medulla from the ventral surface of the calvarium, is also often seen in dogs with Chiari-like malformation and syringomyelia, with a higher degree of kinking associated with increased clinical signs. The closeness of the atlas to the skull, the impingement of the odontoid peg, a bony projection from the axis vertebra, on neural tissue, and changes in the angulation of the odontoid peg all contribute to the complex overcrowding and deformation of the craniospinal junction. Recognizing the signs, when a scratch is more than just an itch. For owners and veterinarians, recognizing the clinical signs of Chiari-like malformation and syringomyelia can be challenging because they are often varied and can mimic other conditions. In humans, neuropathic pain is the most consistent and debilitating symptom, manifesting as headaches or radiating pain and abnormal sensations like prickling or burning. Dogs, of course, cannot verbalize their pain, but several behaviors and physical findings suggest neuropathic pain. One of the most characteristic and often baffling signs is phantom scratching. This is a scratching motion directed towards one side of the body, often the neck, head, or shoulder, where the paw doesn't actually make contact with the skin. It's crucial to differentiate this from true itching or pruritus, especially in breeds like Cavalier King Charles Spaniels, which are also prone to primary secretory otitis media, an ear condition, and other dermatological issues that cause real itching. Phantom scratching is believed to be a behavioral expression of paresthesia or allodynia, which are abnormal spontaneous sensations or pain from non-noxious stimuli, respectively, reported by people with Syringomyelia. Alternatively, it might be a manifestation of fictive scratch, a neurological phenomenon first described in the early 20th century, which arises from hypersensitization of central pattern generators in the spinal cord. Studies suggest that damage to the cervical spinal cord's dorsal horn due to Syringomyelia could influence these scratching neural circuits. Beyond phantom scratching, other signs associated with Chiari-like malformation pain include spontaneous vocalizations, such as yelping or crying out without an obvious trigger, especially when changing position, being lifted, or shifting when lying down. Dogs may also exhibit spinal pain, head or ear rubbing, difficulty jumping or using stairs, reduced activity levels, and disrupted sleep. Behavioral changes, like increased anxiety, aggression, or withdrawal, are also reported. These signs collectively form what is referred to as Chiari-associated pain, or CMP. When Syringomyelia progresses, especially with large syringes, it can lead to more overt neurological deficits, indicating a myelopathy or disease of the spinal cord. These can include proprioceptive deficits, which are problems with spatial awareness, lower motor neuron signs in the front limbs, leading to weakness, ataxia or incoordination, and paresis or partial paralysis. In young animals with large, often asymmetrical, syringes, torticollis, a twisted neck, and scoliosis, a curved spine, may develop due to a loss of proprioceptive input. Owners might mistakenly interpret mild torticollis as a head tilt, leading to an incorrect diagnosis. Clinical signs are often worsened by excitement, stress, neck collars, or even changes in temperature or barometric pressure. It's important to remember that Chiari-like malformation alone can have a significant impact on an animal's welfare and quality of life, even without visible Syringomyelia. However, diagnosing Chiari-like malformation pain can be challenging because the signs are nonspecific and can have other explanations. The diagnosis often relies on ruling out other causes of pain, combined with consistent clinical signs and magnetic resonance imaging findings. The diagnostic journey, peering inside the brain and spine. To definitively diagnose Chiari-like malformation and Syringomyelia, advanced imaging is essential. While plain radiographs are not recommended for diagnosis, they might reveal suggestive features like a flattened supraoccipital bone or close proximity of the atlas to the skull. In severe Syringomyelia, radiographs might even show a widening of the cervical spinal canal due to increased intraspinal pressure. Dynamic radiographs, taken with the head flexed and extended, can be useful to assess the stability of the atlantoaxial joint, especially if surgery is being considered. Computed tomography, or CT, offers limited value in directly assessing Chiari-like malformation and Syringomyelia, beyond confirming cerebellar herniation and defining bony craniocervical junction abnormalities. However, it is invaluable if vertebral malformations are suspected, particularly for surgical planning involving implants. Myelography, often performed with CT, can be used to investigate Syringomyelia secondary to arachnoid diverticula or webs, which are alternative causes of cerebrospinal fluid obstruction. This involves injecting contrast material into the spinal canal. However, it's generally not indicated for Syringomyelia secondary to Chiari-like malformation, and performing it in an already narrowed subarachnoid space due to Syringomyelia requires an experienced operator. The undisputed gold standard for diagnosing Chiari-like malformation and Syringomyelia is high-field magnetic resonance imaging, or MRI. MRI allows for a detailed visualization of the brain and spinal cord, including soft tissues and fluid spaces. A typical MRI study for this condition should, at minimum, cover the brain from the interthalamic adhesion to the fifth cervical vertebra and include T1 weighted and T2 weighted images in both sagittal and transverse planes. However, because syringes can extend into the thoracic spinal cord, many practices routinely image through at least the third thoracic vertebra. Multiplanar imaging is crucial for assessing cerebellar vermis herniation, the dimensions and locations of syringes, and any secondary ventricular dilation. The abnormalities characteristic of both Chiari-like malformation and Syringomyelia are readily visible with MRI. The British Veterinary Association, or BVA, and the Kennel Club in the UK have even published grading guidelines for classifying the structural severity of these diseases, which are used in breeding protocols. For Chiari-like malformation, dogs are graded based on the appearance of the cerebellum and the subarachnoid space. For Syringomyelia, the grade is determined by the syrinx diameter, measured in the transverse plane at its largest point. It's important to note that positioning during imaging acquisition matters, as flexing the head can significantly increase the apparent severity of cerebellar herniation. Despite the clarity MRI provides for visualizing these abnormalities, there isn't one specific imaging parameter that can universally predict the severity of clinical signs or disease progression. The correlation between morphological characteristics and clinical signs is often poor. This has led to the exploration of advanced MRI techniques like cine MRI, which can quantify cerebrospinal fluid flow velocity and turbulence. Cardiac-gated cine MRI, synchronized with the heart's rhythm, provides detailed information on how cerebrospinal fluid flow is affected during systole and diastole, and can detect increased cerebellar pulsation in affected dogs. Studies have shown that obstructed cerebrospinal fluid flow and more turbulent flow at the foramen magnum correlate with the presence and severity of Syringomyelia. Another advanced technique, balanced steady-state free precession sequences, or BSSFP, is recommended for improving the detection of arachnoid webs and diverticula if the cause of cerebrospinal fluid channel disruption isn't immediately apparent on standard MRI. Beyond imaging, cerebrospinal fluid analysis is recommended for all patients undergoing a workup for suspected Chiari-like malformation and Syringomyelia. This helps rule out other inflammatory neurological diseases that might present with similar clinical signs or MRI appearances. Despite the caudal displacement of the cerebellum, cisternal puncture for cerebrospinal fluid collection does not appear to carry increased risk beyond the average patient. Managing the condition, a multifaceted approach. Managing Chiari-like malformation and Syringomyelia is a significant challenge, requiring a multifaceted approach aimed at alleviating pain and neurological deficits. Treatment goals primarily focus on managing neuropathic pain and phantom scratching, often involving both medical and surgical strategies. Medical management. Pharmaceutical interventions typically include a range of medications. Antiepileptics, drugs like gabapentin, pregabalin, and topiramate are commonly prescribed for neuropathic pain. Gabapentin and pregabalin work by binding to specific subunits of voltage-gated calcium channels, which are upregulated in neuropathic pain states. They also seem to suppress phantom scratching, possibly by affecting inhibitory neurons in the spinal cord. While some studies on gabapentin for acute pain in dogs have shown mixed results, its strongest rationale is for chronic neuropathic pain. Pregabalin has a similar mechanism, but a longer half-life and higher oral bioavailability, making it an option for dogs not responding to gabapentin, though its cost can be a limiting factor. Topiramate modulates sodium and calcium channels, potentiates GABA, and blocks excitatory glutamate transmission, also having a minor role in inhibiting carbonic anhydrase. Tricyclic antidepressants, or TCAs. Though less frequently used in veterinary medicine for this purpose, TCAs like amitriptyline are first-line therapies for neuropathic pain in humans. They are believed to work by inhibiting the reuptake of noradrenaline and serotonin, neurotransmitters involved in pain modulation. N-methyl diaspartate, NMDA, receptor antagonists. Amantadine, originally an antiviral, is now used for neuropathic pain. NMDA receptors play a role in wind-up, a chronic pain state, and amantadine works by keeping these receptors closed. It may decrease central sensitization and enhance the effects of other pain medications. Opioids. While opioids can reduce neuropathic pain in humans, their use for chronic management is controversial due to side effects and potential for tolerance and hyperalgesia. Tramadol, a weak opioid agonist, is often prescribed but has limited evidence for chronic neuropathic pain in dogs. Nonsteroidal anti-inflammatory drugs, or NSAIDs. The rationale for using NSAIDs like carprofen or meloxicam for chronic neuropathic pain is debated, though some clinicians find them useful. While COX-1 and COX-2 enzymes are upregulated after nerve injury and contribute to neuropathic pain, studies in dogs haven't consistently shown NSAIDs to improve quality of life for Chiari-like malformation and Syringomyelia. Corticosteroids. Medications like prednisone or dexamethasone offer multidimensional benefits, inhibiting pro-inflammatory mediators, decreasing substance P, a pain-transmitting chemical, and potentially reducing cerebrospinal fluid production. Due to side effects, they are often reserved for flare-ups or as a second or third-line treatment. Proton pump inhibitors, or PPIs. Omeprazole has been suggested to decrease cerebrospinal fluid production, potentially reducing cerebrospinal fluid pressure and Syring's progression. However, whether oral administration leads to a sustained decrease in cerebrospinal fluid production is questionable, and interactions with other medications like gabapentin need to be considered. Itch reflex inhibitors, meropitant citrate, an NK1 receptor antagonist, is used for chronic itch and has been proposed for phantom scratching, assuming it's a neuropathic itch. However, recent neuroanatomic studies may not fully support this, and more research is needed. Surgical management. Surgical intervention is considered when medical management fails, causes adverse drug effects, or if neurological signs continue to progress. The main goal of surgery is to prevent Syring's enlargement and improve pain-related behaviors. The procedure, often called cranial cervical decompression, suboccipital decompression, or foramen magnum decompression, involves removing a portion of the occipital bone and the dorsal part of the atlas vertebra. Often, a portion of the dura mater, the tough membrane surrounding the brain and spinal cord, is also removed or marsupialized. Some surgeons also perform a cranioplasty, using titanium mesh and other materials to reconstruct the caudal occiput, which some suggest might reduce scar tissue formation and improve long-term outcomes. Short-term surgical success rates are high, around 80 to 94%, with better outcomes correlating with a shorter duration of clinical signs. However, long-term relapse rates after foramen magnum decompression alone can be as high as 25 to 47% due to scar tissue formation. Unlike in humans where Syring's resolution after surgery is common, it typically does not occur in dogs, even with short-term clinical improvement, raising questions about whether current surgical procedures fully address the canine condition. Alternative therapies. For dogs refractory to medical management or whose owners prefer non-pharmaceutical approaches, acupuncture is an option. In human medicine, acupuncture is a common treatment for chronic pain, and one veterinary case report described a positive owner-perceived response to dry needling in a Cavalier King Charles Spaniel with Chiari-like malformation and Syringomyelia. Outcomes and quality of life. One of the most common questions from owners is about the long-term prognosis. Studies show that about 75% of dogs with Syringomyelia experience progression of clinical signs over time, even with medical management. However, a significant portion, around 3/4, can still maintain an acceptable quality of life, as reported by their owners. While a subset of dogs may progress to debilitating pain and require euthanasia, a larger group can be adequately managed medically. There are currently no published studies directly comparing the long-term progression and outcomes between medical and surgical management approaches. Assessing quality of life in dogs is challenging, as veterinarians rely on owner-reported behaviors. While only about 9% of owners report a poor quality of life for their affected pets, neuropathic pain behaviors have been linked to various issues, including fear, attachment problems, excitability, and fear of pain-associated activities like grooming. Phantom scratching is the most common owner-reported behavior, and its progression often correlates with a perceived decline in quality of life, impacting activities like leash walks and leading to weight gain. Interestingly, studies have shown a lack of correlation between owner-reported pain scores or phantom scratching and Syring size, suggesting that scratching might not always be a direct marker for neuropathic pain and highlighting the need for more objective pain measures. Ventricular enlargement, a closer look. Ventriculomegaly, or enlargement of the fluid-filled ventricles in the brain, is a frequent finding in Cavalier King Charles Spaniels with Chiari-like malformation. This can occur as a secondary effect of cerebrospinal fluid flow obstruction at the craniocervical junction. One study, enrolling Cavalier King Charles Spaniels with a diagnosis of Chiari-like malformation, found ventriculomegaly in 70% of dogs, with 51% showing moderate enlargement and 19% severe enlargement. However, this research concluded that the prevalence of ventriculomegaly, while high, did not seem related to the severity of clinical signs, the grade of Chiari-like malformation or Syringomyelia, or craniocervical junction abnormalities like medullary kinking. Even when specifically attempting to differentiate between ventriculomegaly and true hydrocephalus, which implies high intraventricular pressure, only a small percentage of dogs, about 7%, were identified as hydrocephalic based on specific magnetic resonance imaging criteria. The study found no significant association between ventriculomegaly and the presence of epileptic seizures, despite the high incidence of seizures in Cavalier King Charles Spaniels with Chiari-like malformation. This reinforces previous findings that ventriculomegaly doesn't appear to play a role in the pathogenesis of epilepsy in this breed. Ventricular asymmetry was also common, identified in 54% of patients, but again showed no significant association with ventriculomegaly severity, suggesting it might be an incidental anatomical variant. The future: data-driven biomarkers and 3D insights. The complexity of Chiari-like malformation and Syringomyelia highlights the need for more objective and accurate diagnostic tools. Recent advancements in machine learning offer promising avenues for research. One study used a data-driven approach to identify soft tissue biomarkers linked to Chiari-associated pain and Syringomyelia in Cavalier King Charles Spaniels. This methodology analyzed mid-sagittal T2 weighted magnetic resonance imaging slices, using image registration to map individual dog scans to a reference dog, and then employing machine learning to identify subtle morphological patterns. Surprisingly, for Chiari-associated pain, the most highly predictive regions, achieving 89% sensitivity and 76% specificity, were found outside the nervous system. These included the caudal end of the soft palate, the larynx and the soft tissue dorsal to it, and the fascia containing the carotid artery. There was also a region at the third cervical spinal cord segment. While these findings were unexpected, they suggest that the skull's conformational changes might also affect the upper airway and associated soft tissues, potentially influencing intrathoracic pressure, sleep, and cerebrospinal fluid movement, or impacting blood and lymphatic drainage from the head. This highlights the value of machine learning in uncovering insights not biased by human hypotheses. For Syringomyelia, the machine learning model achieved 84% sensitivity and 80% specificity, identifying 4 predictive regions. 2 of these were within the brain: the rostral cerebellum and tentorium cerebelli region, and the brainstem immediately ventral to the 4th ventricle. The other 2 were outside the nervous system, rostral to the soft palate, and in the epiglottal region of the larynx, overlapping with some of the Chiari-associated pain biomarkers. The brain-related findings are more easily explained. As in Chiari-like malformation, the cerebellum is typically displaced and deformed, and the brainstem can be kinked. These findings demonstrate that machine learning can successfully analyze morphological changes associated with these developmental disorders, offering strong predictive performance and contributing to a deeper understanding of their pathophysiology. However, current diagnostic imaging predominantly relies on 2-dimensional mid-sagittal images. The future of research, particularly with the Canine Chiari Group's Headspace project, aims to extend these data-driven approaches to analyze 3-dimensional morphologies, providing an even more comprehensive understanding of these complex conditions. This work could not only improve pre-breeding health screening, but also refine diagnostic tools for Chiari-like malformation pain and Syringomyelia in the clinic. In conclusion, Chiari-like malformation and Syringomyelia represent a complex and significant health challenge for dogs, especially the Cavalier King Charles Spaniel. From the intricacies of skull morphology and cerebrospinal fluid dynamics to the varied and often subtle clinical signs and the multifaceted approaches to diagnosis and treatment, our understanding continues to evolve. While it's a journey filled with complexities, the dedication of veterinary researchers and clinicians, coupled with the power of new technologies like machine learning, offers hope for better recognition, more objective diagnosis, and improved quality of life for our beloved canine companions. The goal remains to enhance our ability to manage these conditions effectively and, ultimately, to prevent their transmission through informed breeding practices. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging,